those of you who have seen my video about how I recovered from hip arthritis, from not being able to get in and out of a car to being able to run 10 miles in the mountains with no surgery, will remember that I spoke a lot about nutrition, and that would be what to eat and what not to eat, but I also reference exercise, particular exercises to help rehabilitate the joint. Because I'm not a physiotherapist, I put links to channels on YouTube that I find really useful. But a lot of you have asked me what I did. Which exercises did I choose to do for my hip? So in this video, I'm going to show them to you very quickly and explain to you why I chose those particular exercises. Welcome to Shapefixer. I'm Andrew, I'm a nutritionist, I'm an athlete, I'm a coach, and I really don't suffer from arthritis very much anymore at all, unless I eat really badly and my inflammation goes up. So, what did I do? Well, the exercises that I did, I chose very carefully from the list of options that are available from the channels that I recommend, and that would be El Paso Manual Physical Therapy and Upright Health, and I'm putting links to them both down below here. They are both physiotherapists, physical therapists, and they are excellent. What happens to people typically when they get over the age of, say, 55 is that you start developing muscle wastage, and some muscles will waste away more quickly than others, and that leads to an imbalance in the power and support around the joint. And this is one of the most common causes or contributing factors to hip arthritis in people who, like me, are getting a bit older. And what normally happens is you experience weaknesses at the back, so in the gluteal area, and the muscles in the front stay strong. And when you have this imbalance, the joint is pulled slightly out of alignment, and instead of the force being distributed evenly throughout the joint when there's movement, it gets concentrated on one side of the joint or in one point of the joint, which really causes unnecessary destruction of cartilage. So in addition to healing as much as we can with nutrition and rest, we need to do exercises that restores the balance of power around that joint. So typically, the muscles behind the joint here, so the gluteal muscles, it's the one on the outside here. The gluteus medius tends to shrink and get weaker, while the muscles down the front of the thigh here stay strong. So we want to exercise these muscles, and not so much to just make them really powerful, but just to reactivate them, because they go to sleep. The nerves stop firing those muscles, and the load is taken up by other muscles, which pulls the joint slightly out of alignment. So I'm going to show you three really, really easy exercises. They're almost just movements that you can do in your bed in the morning to help reinvigorate those muscles so that they start giving you some more balance. So the first thing you do, you're in your bed or on a couch on your terrace, and lie on your back with your knees up like this, and just slowly spread your knees, not past the point of pain, because we don't want to cause more damage, and close them and open them and close them, and do this for about 3 minutes. And what this does is the movement in the joint first thing in the morning causes more fluid to go into the joint area and lubricates the joint, so you prepare the joint for being able to do exercise with less discomfort. Okay, so you're really just waking it up. And you can do 3 to 5 minutes like this. Once you've done that, then the next thing you want to do is you want to get blood to flow into these muscle groups, the gluteal muscle groups, all of them. So you lie like this in your bed, and you lift your glutes off the bed, or at least take the weight off them so that you can feel them clenching. It's preferable to do one at a time. So this is the side where I had the hip arthritis, so I'm going to show you on this side. Keep the heel down, push your weight through your heel. This one doesn't have much weight on it at all. You can even lift it up if you want to, but if that's too difficult, it doesn't matter. And you just push the weight through your heel and consciously sense your glute muscles clenching in your bum. If you can lift it right up off the ground like that, that's great. If you can't, don't worry. If you feel your hamstring starting to cramp, put your bum back down and keep it down you just want to clench your bum muscles, your glutes. You don't want to use your hamstrings. If your hamstrings are cramping, it's because they're taking over, and you don't want that. You really want to concentrate on feeling these muscles. And you hold it for 10 seconds or 20 seconds at a time, and you do the other side. You do each side 3 times, maybe 4 times. But you can do it like this. You can just clench your bum muscles. Now you've woken up all the glute muscles, and the blood is in there, and the nerves are awake. The last exercise we want to do is the specific exercise to fire the gluteus medius. And this is the really important exercise now. So you lie on your side, and you bend your knees, and you put your knees directly one over the other. When they're lined up, then you roll your shoulders slightly forward, so you can support yourself on this arm. And what will happen, just from twisting slightly forward, is this knee will go a bit beyond the one that's underneath it, and you then do a simple clamshell exercise. Why you need to lean slightly forward is if you lean back like this and you stay straight, you will be using these outside thigh muscles to lift your leg, and that's not what you want to do. You want to use these gluteal muscles. So you lean slightly forward, and you have no choice now, and you can feel this muscle biting, and that's what you do. And if you can hold it for 5 seconds, that's great. If you can hold it for 20, that's better. If you're finding this really, really easy, you can lift your foot up and have the weight of the full leg. Just hold it for 30 seconds and put it down again. And you do that a couple of times, 3, 4, 5 times, and then roll over and do the other side. Even if you have arthritis only on one side, do all these exercises on both sides so that both your hips stay balanced. And who's to say that your other hip won't eventually develop arthritis anyway? That's it. That's all you need to do. And I've got one more tip for you. If you're finding it difficult to sleep at night on your side and you're having pain, you get someone to throw you a pillow. There you go, my trusty helper. And you put a pillow between your knees, and it just stops. It keeps your leg more horizontal and takes the pressure off the outside of the hip. You can even fold it double if you like. There, you will find that remarkably comfortable. So there you go. Those are the 3 exercises I did. If they're not quite the right ones for you, that's fine. Look at the links below. Go to Upright Health or El Paso Manual Physical Therapy. They have lots of videos with really, really good advice and really good exercises that you can choose from. But these are easy. Anybody can do them. And for a start, I would recommend that you do these. So thank you very much for your engagement. Thank you for watching. Please comment down below. Please share this video with anybody and subscribe to our channel.